welcome. Today's lesson is Can Dementia Be Reversed? I'm Diane Carbo. Dementia is affecting an ever-growing number of seniors. It is not a normal part of aging. There is expected to be 10 million new cases diagnosed globally a year. It is also expected there will be 152 million people living around the world with dementia by 2050. Alzheimer's disease cases in particular are expected to triple in the coming decades. The early symptoms of dementia cause impaired judgment, mood changes, and memory lapses. This impacts a person living with this condition. There is growing concern from the scientific community and family members that are asking, can dementia be reversed? I'm going to be honest, there's no simple answer to that question. You see, there are so many different types of dementia, and there are many different causes of those dementias. The symptoms vary in the early stages in the different dementias, but as people living with dementia advance through the stages, the symptoms of dementia will follow a similar pattern as the brain cells lose connections. So let's talk about a few types of dementia. There is vascular dementia, which is the most preventable type of dementia. This type of dementia, most common cause is high blood pressure and heart disease. Alzheimer's disease is the most common type of dementia. Alzheimer's disease can develop gradually, and many have a family history of it. Lewy body dementia is the second most common type of dementia. It is also the most misdiagnosed dementia. This disease has a buildup of Lewy bodies in the brain. This is often first diagnosed as a psychiatric disorder because of the changes in behaviors and personality. Individuals with Parkinson's disease have a higher risk for developing dementia with Lewy bodies. Then we have mild cognitive impairment occurs in older adults. This is a type of dementia where a person may or may not develop dementia. A person can live with mild cognitive impairment without any support, as they are still able to do familiar tasks. But some do advance to the early stages of Alzheimer's disease. There are some individuals that have more than one type of dementia. This is called mixed dementia. Researchers have actually found individuals that have had an autopsy in the brain have had Alzheimer's disease and vascular dementia at the same time. Then there have been times when a person has been found to have amyloid plaques of Alzheimer's disease, as well as Lewy bodies and vascular dementia, the trifecta. Until recently, to diagnose dementia was done after death. There are now laboratory tests, actually blood tests, as well as genetic testing to tell you if you are at higher risk for developing the symptoms of dementia. So let's talk about reversible dementias. This is in part due to their causes being something temporary. It is not part of a larger systematic issue. Reversible dementias have a variety of causes. These conditions create dementia-like symptoms. Medications, depression, drug and alcohol abuse, head injury, nutritional deficiencies, hormone dysfunction, metabolic disorders, infections, environmental toxins, and even heart disease are causes of reversible dementias. So I'm going to cover the 10 most common causes of dementia-like symptoms. Did you know there's a peculiar condition known as water on the brain? This quirky term refers to normal pressure hydrocephalus, NPH. This is a rare brain disorder that creates a situation where spinal fluid gets stuck in your brain instead of flowing smoothly through it and into your spinal column. This extra fluid can cause a troublesome trio of symptoms: confusion and memory loss, an overactive bladder, and issues with walking and balance. The good news: timely treatment can potentially restore some, if not all, of your affected memory and clarity. So don't wait. Early diagnosis and identification of NPH means better outcomes. Then we have vitamin B12 deficiency. Did you know that Alzheimer's disease and other symptoms include memory problems and mood swings can potentially be attributed to a sneaky vitamin deficiencies? That's right. Low levels of vitamin B12 could be the culprit. Factors like an unhealthy diet, certain health conditions, and aging may contribute to this deficiency. Don't worry, though. Your brain power might just make a comeback by simply supplementing with this essential vitamin. So why not give your memory and cognitive abilities a fighting chance with a little help from vitamin B12? Thyroid imbalance. Ever felt your memory slipping away or having difficulty finding the right words? What about having trouble concentrating and experiencing slowed down visuals? Well, these cognitive hurdles might be due to a sneaky thyroid issue. Hormone imbalance will affect people differently, whether it's hypothyroidism or hyperthyroidism. The good news is, with proper treatment, you can say goodbye to these vexing brain blips. Hey, guess what? Skimping on sleep doesn't just leave you groggy. It can mess with your memory and even shrink parts of your brain that contribute to cognitive decline. Society may glamorize burning the midnight oil, but teens and adults beware. Consistently missing out on a good night's sleep can drag down your mental performance. Fret not, sleep deprived thinkers. There's a cure for this memory thief waiting to be discovered. Getting 7 hours of sleep a night as a priority as part of a healthy lifestyle, you decrease your risk for developing Alzheimer's disease and other dementias. Medication side effects and interactions can also cause a reversible type of dementia. So many find themselves juggling a multitude of medications. It's crucial to keep your doctor in the loop about all your prescriptions, even from the specialist. You also need to make your healthcare providers aware of any nutritional supplements and herbs you take as well. While they may be all natural, they may still interact with your other medications or even the other herbs or supplements you are taking. With multiple medications, there's a higher risk for interactions, especially as we grow older. These side effects cause such things as confusion, memory loss, and impaired judgment, and they're similar to early signs of dementia. The good news is a thorough review of your medication and supplements and herb list would help improve your cognitive function. So have a chat with your physician or your pharmacist and better your brain. I encourage all my seniors to review your medication list with your primary care physician every 6 months. And don't hesitate to ask if there are any medications you can decrease or eliminate. Now let's talk about brain tumors. Although the thought of a brain tumor is undeniably scary, it can sometimes be considered preferable to Alzheimer's disease, thanks to the varying potential for treatment. Keep in mind, brain tumor signs and symptoms cause brain changes that may involve memory, poor judgment, personality shifts, and impulse control. A person's symptoms will vary depending on the part of the brain affected. Rest assured, successful treatment outcomes can range from minimal improvements to complete recovery. Did you know a seemingly insignificant bump on the head can lead to serious complications in older adults? This minor event might trigger a subdural hematoma or hemorrhage, where blood vessels rupture and pool between the brain surface and its protective covering. After a head trauma, keep an eye out for dementia symptoms such as confusion, sluggishness, speech difficulties, and headaches. Treatment options could range from medication to surgery for draining the accumulated blood, and the success of the healing process depends on the chosen intervention. Infections. A sudden change in cognitive ability, such as difficulty concentrating or understanding, can signal a condition called delirium, particularly among older adults. If there is an increase in confusion and lethargy, it could be a sign of underlying infection that needs to be addressed right away for better mental clarity. The first thing I want you to consider when you see a sudden change in cognitive status or behaviors, you should think it might be a urinary tract infection. Infections in the elderly often exhibit these common symptoms. Timely diagnosis and treatment are essential for a person to return to baseline. Did you know depression can strip away motivation, reducing concentration, and causing fatigue? Unfortunately, those same symptoms often overlap with the early signs of dementia, or what the professionals call pseudo-dementia. While it's essential to stay alert for indications that require further investigation of early treatment by a professional healthcare provider, cognitive screening tests are effective in determining the difference between depression and other conditions. By simply understanding your symptoms better and seeking appropriate treatment when needed, you'll be able to take some important steps towards maintaining mental well-being. Did you know that alcohol abuse can sometimes lead to vitamin deficiencies in another vitamin, vitamin B1, also known as thiamine? This deficiency can cause some pretty serious brain conditions called Wernicke's encephalopathy and Korsakoff syndrome. Imagine experiencing a whirlwind of confusion, hallucinations, and balance problems. That's what Wernicke's encephalopathy feels like. Luckily, with quick treatment, it can sometimes be reversed. Now, let's say you manage to overcome Wernicke's encephalopathy. You might still face Korsakoff syndrome, which shares some traits with dementia. Imagine being lost in a world of memory loss, hallucinations, and even fabricating stories without realizing it. A person with dementia may have trouble finding those memories, and they fill in the blanks of their memory loss with false stories, and they believe them. Quick treatment can potentially lead to full recovery if early diagnosis is made. Although a tough journey, there's still hope. Around 25% of those with Wernicke-Korsakoff syndrome will fully recover, according to the Alzheimer's Association. So I want to talk now about research on reversing dementia. There is breaking news from the world of science. A thought-provoking study in molecular neurobiology on the origins of Alzheimer's disease. It has put the spotlight on tau protein, or amyloid plaques, levels in mice. This protein is a prime player in Alzheimer's disease and is the apparent reason for the destruction of nerve cells in the brain. Our scientists have zeroed in on leukotriene levels. Those inflammatory mediators have good intentions, but end up causing nerve cell damage as dementia progresses. The researchers experimented with a zolutron, a curious drug determined to stop leukotrienes and save the brain cells. Exciting discoveries have shown that mice treated for dementia experienced a significant, as much as 50% drop in harmful tau protein levels and an impressive improvement in their brain's nerve cell connections. This breakthrough fuels hope that dementia may indeed be reversible, leading to cutting-edge research and a dedicated team of scientists. A program like the RECODE program, RECODE, is creating treatment approaches that focus on tackling the root causes of Alzheimer's disease. This program strives to support the brain's natural ability to achieve a healthy balance between forming new connections and clearing out unnecessary ones, ensuring optimum brain health and cognitive function. Alzheimer's patients often struggle with an imbalance of brain activities. The most common warning signs of Alzheimer's is an individual may lose interest in life. They may occasionally forget appointments or have difficulty finding the right word or make up unusual words or struggle to remember recent events. With the RECODE treatment strategies, researchers aim to restore balance using a mix of diet, lifestyle, supplements, herbs, and medications. Though success is yet to be determined, this approach joins a few other promising research avenues that may pave the way for effective long-term dementia treatment, including potentially reversible forms of the condition. So let's stay hopeful. This has been brought to you by Caregiver Relief.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.